Hi, and welcome back to our channel. This video is part 2 of my 3-part series on celiac disease and gluten sensitivity. If you have not already watched part 1, where I discuss what celiac disease is and what the common symptoms are, be sure to click on the link in the description box to watch that video. The timing of this series is actually perfect because May is Celiac Disease Awareness Month, and this is one of those health conditions that really does need more awareness because it is so underdiagnosed. And today we're going to be talking about how celiac disease is diagnosed, and we're also going to talk about what could be going on if you have a lot of the symptoms of celiac disease, but maybe your blood tests come back negative. Okay, so first I want to talk about who actually gets celiac disease. And it's important to understand that you have to be genetically susceptible in order for true celiac disease to develop. Celiac disease occurs in people who have certain gene variants within a specific genetic complex. And that complex is called HLA, or the human leukocyte antigen complex. And these are just genes in the body that help to distinguish between its own proteins versus the proteins of foreign invaders like viruses and bacteria. There are 2 important HLA gene variants that relate to celiac disease, and those are called HLA-DQ2 and HLA-DQ8. DQ2 is the most common variant, and having 1 copy of the DQ gene raises your risk of celiac disease by about 10-fold compared to people who do not have any copies of either variant. If you have 1 copy of DQ2 plus 1 copy of DQ8, the risk increases by about 14 times. And if you have 2 copies of DQ2, the risk is over 30 times. So in other words, you need 1 or more of these genetic variants to develop celiac disease, but it's really important to understand that not everyone who has these variants will develop celiac disease. About 1/4 of the population has at least 1 copy, but most of these people will not go on to develop celiac disease. Remember that celiac disease is an autoimmune condition, and as we've discussed in my other videos, if you've been following us for a while, you'll recall that autoimmunity develops in the context of genetic predisposition, a leaky gut, and some sort of environmental trigger. An environmental trigger can be anything from an infection to emotional stress or even a toxic exposure like chemicals or metals. So there has to be this perfect storm. Now, I want to stress that the HLA genetic testing cannot diagnose whether you actually have celiac disease or not. It just tells you whether you have the potential to develop it. And even though there are other tests that help to diagnose celiac disease, and I'll discuss those in just a moment, I still think it's worth testing for the genetics, especially if you have a family history. So what are some of the other tests that can help with the diagnosis? First, let me say that usually a whole panel of tests is ordered because there is no single test that is accurate enough to pick up everyone who has celiac disease. Usually a celiac panel includes endomysial antibodies, tissue transglutaminase antibodies, total IgA, and deaminated gliadin peptides. And the reason we look at so many different markers is because some patients can have negative tissue transglutaminase antibodies, but positive deaminated gliadin peptides, or vice versa. I'm a big fan of testing the endomysial antibodies because it is nearly 100% specific. That means there's no other medical condition besides celiac disease that would cause that test to be positive. Tissue transglutaminase antibodies can actually be elevated in other conditions besides celiac disease, like diabetes or liver problems or inflammatory bowel disease, even if the person doesn't have celiac. And the other great thing about the endomysial antibodies test is that it's about 90% sensitive, meaning that most people who truly do have the disease will have a positive test result. So we've talked about testing for celiac genetics, and we've talked about some of the other blood tests that can look for certain antibodies. What I want you all to know is that because of the inconsistencies with the blood tests, the gold standard for diagnosing celiac disease is the intestinal biopsy. And that means that a person will undergo a procedure called endoscopy, where a thin tube or scope is passed down through their throat, through their stomach, and into the small intestine, skin so that the doctor can look at the intestines and take a small sample of tissue at the same time. And what they're looking for with that tissue sample under the microscope is damage to the cells that line the intestine. We have these finger-like projections called villi on the tips of our intestinal cells, and they're really important for helping us to absorb nutrients. And the autoimmune process of celiac disease causes a blunting or a loss of these villi, those finger-like projections. So that's what they're looking for to confirm the diagnosis. Now, there is one other very specific way to confirm a celiac diagnosis, and that is if you have the celiac rash. That rash is called dermatitis herpetiformis, and it's a red, extremely itchy, blistery rash that's usually on the shins, elbows, knees, back, and buttocks. If you have this rash, the doctor can pinch off a sample of your skin to look for deposits of immune proteins within the skin. And if they confirm that the rash is in fact dermatitis herpetiformis, then that officially confirms the diagnosis of celiac disease, because that rash is only associated with celiac disease. So what if you get tested for antibodies, or you have the skin biopsy done and everything comes back negative, but you know that wheat and gluten makes you feel sick? Well, a few things could be going on. First, I think about something called latent celiac disease. This is where a person has negative blood tests that eventually turn up positive several months or even years later. Children especially don't always have positive antibodies at first. People with latent celiac disease can also have positive blood markers, but a negative intestinal biopsy. And the conventional recommendation is that people with latent celiac disease should not be prescribed a gluten-free diet because it's unnecessarily restrictive. I disagree. I feel that if you have positive blood tests and a negative biopsy, it's probably only a matter of time before you start having intestinal damage. Having antibodies is a sign that your immune system doesn't like what it's being exposed to. And remember that autoimmunity develops over time, and sometimes it takes decades for it to fully manifest. So my stance is that if your celiac antibodies are positive, a gluten-free diet would probably be in your best interest. Another thing that could be going on if your tests are negative, but you know that gluten gives you problems, is that you were already avoiding gluten before getting tested. It's really important to know that once you start avoiding gluten, your immune system stops making as many antibodies against it. And so if you've been gluten-free for a while and then you decide to get tested, there's a strong chance that your antibody levels will be so low that they're not detected and you'll get a negative blood test. That's why it is recommended to keep eating gluten every day before you get tested. Now, obviously, if you already know that gluten makes you feel sick, you're probably not too keen on the idea of eating large amounts of gluten every day for a month or longer. And I know that a lot of people refuse to do this, so they just assume that they have celiac disease or gluten sensitivity, and I think that's fine for some people. However, if you're the kind of person who would struggle to commit to a lifelong, strict, gluten-free diet without a compelling reason to do so, then I think testing is worthwhile, because a positive result gives you that proof that you really do need to be gluten-free. Now, some people get very sick when they eat gluten, and they don't have celiac disease, but rather non-celiac gluten sensitivity. And it is possible to be gluten intolerant but not have celiac disease. Anyone who has symptoms that are brought on by eating gluten and that go away when gluten is removed from the diet can be called gluten intolerant. And for a lot of people with irritable bowel syndrome, they have their symptoms improve when they take gluten out of their diet, for example. Non-celiac gluten sensitivity is a syndrome where a person has symptoms related to eating gluten, but they don't have celiac disease, and they may not even have a true wheat allergy. There is no specific test or blood marker for non-celiac gluten sensitivity, but the first step is to try a gluten-free diet for at least 6 weeks to see if the symptoms improve. And if they do, some practitioners would recommend that you add gluten back into the diet to see if the symptoms return, and then that helps them determine the diagnosis of non-celiac gluten sensitivity. Now, a lot of people self-diagnose their celiac disease or gluten intolerance based on their symptoms, and frankly, it can be really hard to get a doctor to listen to you and order the testing that you want. Also, I know a lot of you out there want to know if you have celiac disease, but you're not willing to do the gluten challenge because you know it's going to make you feel really sick. And I also realized that a biopsy is a really invasive surgical procedure, and that deters a lot of people from wanting to get tested, especially if it's for a young child. Thankfully, though, the healthcare community is coming around and starting to accept diagnostic criteria for celiac disease that doesn't have to involve the biopsy. In recent years, there's been a group of European researchers who are celiac experts. They've proposed a set of alternate diagnostic criteria that I've started using in my own practice. So according to this group of researchers, people can avoid the scope and the biopsy if they meet these 4 criteria. So first, they have to have signs and symptoms that are compatible with celiac disease. Second, they have to have the positive blood markers. Third, they have at least one of the predisposing genes. And fourth, their symptoms go away and their blood work gets back to normal after adopting a gluten-free diet. Now here's my caveat. Not everyone will have positive antibodies in their blood work, especially kids, as I mentioned earlier. So everything within a person's medical history and all of their symptoms have to be taken into consideration, and there isn't always a linear path to getting a diagnosis. Another test that can be very helpful is the Cyrex Labs Array 4 panel. This is a specialty test that looks for gluten cross-reactions with other foods, and it's especially helpful for people who've been strictly gluten-free, but they still aren't feeling well, or maybe they notice symptoms when they eat certain foods. For example, you could eat dairy or white potato and your immune system reacts as if you had actually eaten gluten. So by identifying any non-gluten foods that are still problematic for your immune system, you can remove these things from your diet and give your body a better chance at healing. So should you get tested? Well, if you have a family history of celiac disease, then I would recommend at least getting tested for the celiac genes. Remember that the genetics increase your risk of celiac disease by 10 to 30 times higher. Also, if you have type 1 diabetes, I would also recommend getting tested because those two conditions occur together so frequently. If you or your child have short stature, or if you have a child that's below the growth curves or has failure to thrive, then celiac disease should definitely be ruled out. Remember in part 1, I mentioned that sometimes kids being short or small for their age is the only sign of celiac disease. I would also recommend that anyone with GERD or acid reflux, chronic depression or weakness or chronic fatigue get tested. I'm going to leave some links down below for the celiac test that you can order yourself through True Health Labs. And I'll also link to a couple of relevant research articles just in case anyone likes to read science as much as I do. So I hope you guys found this helpful. Thank you so much for spending some time with me today. We are always so grateful that you guys tune in and leave such great comments. I'll see you back soon for part 3 of this series, where we'll dive into what it really means to live with celiac disease and what it means to live a truly gluten-free lifestyle. Is a gluten-free diet enough, or are there other things we need to do to support healing and maintain good health? So that's what we'll talk about next time, and I hope to see you back soon for that video. Be sure to hit that subscribe button and give us a thumbs up if you liked this, and I'll see you next time.